A University of Otago professor has made the list of the world's top 1% of the most cited science researchers. Professor Richie Poulton is the director of the Dunedin Multidisciplinary Health and Development Study. He joins us to talk about his work and the recognition it's brought. Good evening, Professor Poulton.
Hi, Rebecca.
Now, tell us about the list of the most cited researchers.
It's a list that has been put out by Thomson Reuters, which is the official agency that does all these ratings around the world. And it came out about a month ago, and it was a new list, and it refers to the period of work between 2002 and 2012. And it's a list of the top 3,200 researchers in the world across 21 different disciplines. And I was lucky enough to find my name in that list when it came out.
Is it the first time you've made the list?
It is, yep.
Wonderful. What does the recognition mean to you?
At a personal level, it's, I guess, affirms all the hard work over so many years, and in some ways justifies the sacrifices that family make in terms of time not spent with them and working on the research. This time you can't get it back, so it's lovely in that sense. More importantly, I think it recognises the study I lead, and I would not personally be on the list if it were not for the high quality information and data that the Dunedin Study has amassed over 40 plus years.
Are there any other New Zealanders on the study?
There's three, on this list there's three other New Zealanders, one from Lincoln University and two from Auckland.
Were you surprised about being one of the world's most cited researchers?
Yes and no. I mean, I knew our research had impact and was well regarded around the globe, but I didn't know that the list was coming and the way it was going to come. Nor that I was going to be on it. It's just, I guess, reinforcement, as I say, for the amazing database that the Dunedin Study has amassed over such a long time, and the high quality work of all my colleagues, because if it weren't for them and standing on their shoulders, almost literally, I don't think I'd be on the list.
Tell us a little bit about the study.
Well, it's been going for 41 years now. It started in the early 70s. It's a birth cohort. It's everyone born at Queen Mary Hospital in 1 year between 1972, April 1st and March 30, 73. And this group of 1,037 babies have been followed repeatedly as they've grown up and measured and asked a zillion different questions on all aspects of their health and development. And it's now arguably the most rich source of information on human health and development ever amassed in the world, and it's held up as a gold standard of this type of research. And I suppose that again explains, why someone like myself might be on this particular list. It's testament to the quality of that the study and its foundations in the Dunedin community, I should say. It was founded very much as a community-based study. A lot of volunteers helped in the early years. In recent years, as we've become internationally well known and have a high profile, we get more money from overseas agencies as well as New Zealand agencies. But in the early days, first decade, it was really run on the smell of an oily rag and the goodwill of the Dunedin community.
What is the next phase of the study? Next
phase literally will be, the next assessment will be when all our study members are age 45, and we'll bring them back from wherever they are in the world, and about a quarter live overseas now, and we'll bring them back to the Dunedin Research Unit, and they'll undergo all manner of tests on everything you can think of and be asked 1,000 different questions and poked and prodded. And they will put up with that very gracefully, and they do it on the basis that it will help others. So this is an incredible study in so much you've got this reservoir of goodwill that continues on, and it's a privilege to be part of.
Will your status on the list have some positive spin-offs for the university and the city, do you think?
Well, I think it's nice that the university can have people on that list. It counts in the measurement of status and the grading of universities in the world. Everyone that's involved in the study should feel good about it. I hope the study members themselves, because they're the real heroes, can feel chuffed as a result.
Professor Richie Poulton, thanks so much for your time. Congratulations.
Thank you.